Hello everyone, my name is Aiswarya Lakshmi and I'll be presenting my leadership project on improving NCD screening through capacity building, community mobilization and coordination. It's well known that NCDs are a major public health problem globally. NCDs account for nearly 63% of the total deaths in India, out of which 50% are due to the four major NCDs, namely cardiovascular diseases, cancers, chronic respiratory diseases and diabetes. High blood pressure and high blood glucose are considered as biological risk factors in the causation pathway of chronic non-communicable diseases. The National Program for Non-Communicable Diseases envisages that all individuals aged 30 years and above must undergo screening for hypertension and diabetes. Hypertension screening is by BP measurement, blood pressure measurement, and the diabetes screening is through a finger prick test using a glucometer. Both the tests are simple and can be performed in the peripheries. The National NCD Monitoring Survey has interesting insights to the health-seeking behaviors for hypertension and diabetes. The survey found that only 1 out of 2 individuals aged 30 to 69 years had undergone blood pressure measurement ever in their life, and 1 in 4 had ever undergone a blood glucose measurement in their life. The numbers are even lower if you consider the individuals who have undergone these tests in the past 12 months. A study which did an analysis of the NFHS 5 dataset found that in Meghalaya, only 31% of the individuals with hypertension were diagnosed or aware of their conditions. Even among those who were diagnosed, nearly 40% were not taking any medicines, and among those who were treated, more than half were having uncontrolled blood pressure. This brings me to my leadership project. How do we improve the hypertension and diabetes screening? Three strategies that can be used to achieve this outcome are capacity building of the health staff, identifying the platforms to improve community participation, and coordination and advocacy at the state and district level. Capacity building of health staff is being undertaken through providing job aids to guide not just screening, but also ensuring that there is a continuum of care for patients who are diagnosed with hypertension and diabetes. We also developed talking points in local languages and provided the same to health workers for their use during community meetings. With the talking points, the healthcare workers were able to deliver authentic information on hypertension and diabetes, including the risk factors and the need of screening and how to manage these common conditions. We identified platforms for improving community participation like the village health councils and self-help groups. PHCs are led by the village headman and has a general body comprising of male and female heads of the households and an elected executive committee in which 50% of the seats are reserved for women. Asha, Anganwadi worker, ANM are among the permanent members of the village health councils. There are self-help groups which are another avenue for community mobilization, which are under the umbrella of the State Rural Livelihood Mission. The meetings of the Village Health Council and self-help groups can be utilized by the healthcare workers to speak about NCD screening, and the camps may be planned in consensus with these organizations who can help mobilize the community. I have embodied the pillars of the leadership journey in my project. Coordination with the key stakeholders at the state and district NCD cells ensure that the activities are strategic and impactful. Providing healthcare workers with talking points in local languages ensure that the messaging is clear, relatable, and culturally appropriate. Training healthcare workers on screening, diagnosis, and referral empowers them with the confidence and credibility and strengthening community trust. Partnering with existing community structure ensures that the messaging reaches the right audience through trusted channels. All this ensures that the activities are authentic and inclusive. I would like to end my presentation by expressing my sincere thanks to the WomenLift Health team, my coach, and my mentor for all their supports in developing my leadership skills. Thank you very much.